Yeah, D3 spray. We've actually made a very, very high dose of this product because the product's fat soluble and the liver is quite happy to store it until it's needed. So if you forget to take it every day, no problem, you'll always have a reserve of it. It's important to have a reserve in your body of vitamin D3 because it performs a lot of functions. Normally vitamin D is made in the skin, but unfortunately in England we don't always get enough sun to make enough vitamin D. And in fact they calculate that if you live above Birmingham, north of Birmingham, then you're going to be deficient in sunlight, so you need to have more vitamin D from your food sources. Being low in vitamin D is really serious, because vitamin D is responsible for moving minerals like calcium and potassium about the body, and they're pretty important for bone development, but also for cardiovascular risk and a lot of other things like that. Bone density decreases as you get older. When you get to the menopause, it decreases really dramatically. So that is the point when you really need to use some vitamin D to keep the calcium moving about. And what you do is you move the calcium from your blood into your bones, and that's how it works. Buying from the internet, you're not really sure of the quality of it. This product's been put together by a pharmacist, and it's a really good quality product. It's well presented, but also it's got a dosing system that's pretty unique. If you take a tablet or a capsule, you're likely to not absorb more than about somewhere between 25 and 50% of the dose in that capsule. Whereas if you take it by this type of spray is a mist. So you've got a really high volume of very, very small particles hitting the throat and the mouth. It's called a buccal mucosa, and the absorption is really instant. It doesn't sort of hit there and then run down your throat to be managed in the stomach. It's absorbed straight from the mouth. Well, again, in obesity, there's probably no shortage of vitamin D, depending on the food, the diet of whoever's obese, but the problem is, the minute you start treating obesity, then you tend to cut out the foods that have vitamin D in them. It regulates a lot of things, but mainly the blood supply, and the blood supply to the pancreas is increased, and that gives you more insulin into the system.